I think outbreaks have a huge impact on public perceptions. I think when you don't see a disease circulating in your community for, in some cases, years, you become complacent, and the parents can't be blamed for that. Doctors become complacent because they don't see it in their practice, and many doctors don't even know how to diagnose it when they don't see it after a period of years. So an outbreak really emphasizes, possibly the worst way to emphasize, but in some ways the best ways to emphasize, the severity of the diseases and the risks we run by not vaccinating our children. What we're seeing in Europe at the moment is rather high vaccination coverage. What we're suffering from is the consequences of historical weaknesses and decisions that were made by parents many years ago. Now, it would be incorrect for us to say that it all comes down to parents, actually, because it's the healthcare workers, the politicians, the decision makers also play a role. When we talk about complacency at a parental level, we've also got to talk about complacency at a healthcare worker level, and we've got to talk about complacency in terms of political commitment and support. Every one of our member states is committed to the 2015 elimination goal. They need to stand by that commitment. They need to make sure that the investments are there in terms of human resources and financial resources. And they need to invest, they need to either maintain or ramp up investment in immunisation. We can eliminate this disease. They know that. They need to commit and stand by that commitment. On the other hand, with the healthcare workers, as I was saying a moment ago, we can't afford to have complacent healthcare workers. They are our front line. If your healthcare worker is not vaccinating, the likeliness that you will vaccinate your children is pretty minimal. Still, up to 70% of parents are telling us that the key tipping point or trigger for their behaviour is the healthcare worker. So they are a critical point in this process. On the other hand, you've got this issue with a confidence. So we've talked about 3 C's today. We've talked about complacency, confidence, convenience. With confidence, we see that playing out at a parental level, as we've discussed now, and we've seen it play out in the late 90s, the early 2000s with the Wakefield and autism MMR scare. People still concerned about vaccination, both the vaccine and the services that provide them in some countries in terms of their trust or lack of confidence in it. But there's also a trust and lack of confidence issue with healthcare workers. We have a significant minority of healthcare workers that are pushing back against, or at least not actively motivating parents to vaccinate their children. That is incredibly damaging and incredibly concerning. Again, we have the healthcare worker, the parent, and the politician or the decision maker who've got to take up their responsibilities. So we cannot put it all on the shoulders of the parents.
Yeah, when it comes to healthcare workers, it is our responsibility to educate them as much as we can on the subject of vaccinology, on the benefits and of vaccines and the risks of the diseases that we no longer see. Therefore, it's important that our future doctors are able to recognize or at least suspect the cases, so then they can be tested to confirm or otherwise the disease.
And the other point I wanted to make on this was also that, I mean, we're constantly deriding parents who don't vaccinate their children. And I think we talked a little bit earlier about active listening. I think we've got to sit back and listen to the arguments more, the parents who hesitate or refuse to vaccinate their kids. What are their arguments? What is the evidence they have? What's the information they have? And what are they basing their decision on? There's too much criticism of those parents who think they are making the best decision for their children. They truly believe that they are. So let's start listening to them and learn from that.